as an athletic therapist, I have lots of tools and techniques to use to fast track my patients. And one awesome technique is called a contrast bath. Now, it's not a fan favorite, but it definitely does the trick. So if you're kind of stuck with an injury, this might be quite helpful for you. So I'll give you a little background before we go into the whole contrast bath thing. So when you have an injury, when there's damage to any tissue, your body's going to try to fix it up. And it does it in the form of swelling by sending healthy cells to that area to fix it, which is great. Except for sometimes it sends way too much swelling, way too much fluid, and it limits your movement and your mobility, your range of motion. It causes some pain and discomfort. And so sometimes too much is, well, just too much. So, so we're gonna try and manipulate that, and that's part of my job. Now, the other things we need to know before we do the contrast bath, before I do the contrast bath, is the importance of heat versus ice. So heat is awesome because when you apply heat to an area, it is going to be used for pain control. It's going to help with reducing muscle spasms. It increases blood flow, which then it helps to relax muscles, and then in turn, it helps to increase range of motion because then you kind of get rid of joint stiffness, which is awesome. It's all great. The only thing is you have to heat a certain amount to get through the thickness of the tissue. If it's not enough, you're not getting anything. If it's too much, then you might cause tissue damage. So you do have to be careful with heat. So when you apply ice to the area, it's going to numb the nerve endings. It's going to constrict or kind of shrink down. So constrict means to become narrow. Your blood vessels. And so the blood vessels that are carrying all that swelling into that area where it's damaged, it's going to be shrunk down in size, right? Because it's constricted, that you limit the amount of blood flow coming in. Now here's the thing, ice will not stop any, it won't get rid of the swelling that was there initially, but it will definitely stop anything that's coming after the fact. And so by doing that in return, we're basically slowing down the metabolic processes. So kind of cool how we can manipulate all of that. So what we're going to do with the contrast bath is we're going to apply ice first just to kind of calm things down because you're coming from an acute stage and you're trying to transition from that fresh injury to, okay, it's a few days now, let's get it moving. But we're not too sure if we're going to have swelling or we can kind of push it a bit. So we're going to apply the tissue in ice just for a minute, and then we're going to take it out, and then we're going to put in heat, and then we're going to move around, and we're going to go back to ice and back and forth. And you always want to finish on a contrast bath with ice because you want to make sure that we don't aggravate the tissue and cause more swelling to occur. So I'm going to try and do this before the ice melts. So you're going to stick your hand in cold water, and you're going to spell the alphabet. So A, B, C, D, E. Okay, do that for a minute. Then you're going to switch into the, oh, nice warm. Oh, okay, that's hot. All right. And we're going to try to get that moving. Okay, and then we're going to go back into the cold. Oh my. Okay, so A, B, C, D. Okay, and then back into hot. Much better. Woo, and then we finish with some ice. That's melting pretty quick. All right, so that's how you guys do a contrast bath. It's not the most pleasant therapy tool, but it is a great transitional therapy application that, you know what, makes a huge impact and helps to move you along, especially when you're transitioning from that acute stage to the chronic, where you kind of want to get rid of using ice, but you're not too sure if heat's okay or you're going to cause more damage. So it's great. It's, like I said, it's transitional, and just make sure you got a towel around because you might end up making a little bit of a mess, because I think I did. All right, well, thanks for watching. I'll see you guys later. Bye.